Knee OA is a degenerative joint condition where the cartilage that cushions the ends of the bones in the knee gradually breaks down. If you work in the healthcare sector or are among the many individuals suffering from it, you likely understand the critical role that exercise and weight loss play in managing the condition in overweight and obese individuals. These strategies are universally recommended as first line treatments by all international clinical guidelines. Exercise is a cornerstone of OA management, and physiotherapists are uniquely qualified to guide patients through this aspect. While professionals like personal trainers can help improve general physical activity, which has been shown to alleviate knee osteoarthritis symptoms, physiotherapists offer a distinct advantage. They are trained to deliver therapeutic exercises which address specific impairments related to OA, such as mobility restrictions, muscle imbalances, and regional instability. This specialized approach is why systematic reviews and clinical guidelines strongly recommend that knee osteoarthritis management programs include physiotherapists. The second critical component of OA management is weight loss. Research highlights the significant impact of weight loss on knee joint health. Every 1 pound of weight loss results in a 4-pound reduction in knee joint load, and a 10% weight reduction has been shown to improve pain, function, and quality of life in overweight and obese individuals, while reducing joint loads and inflammation. However, despite its importance, clinical guidelines often leave this component vague, offering little detail on the best approaches for achieving sustainable weight loss. But evidence suggests that working with a dietitian or nutrition coach is critical for effective weight management. One study found that individuals undertaking a structured weight loss program with professional guidance lost 2.6 kilos more on average over 12 months than those receiving education alone. In addition to weight loss, a nutrition professional can address other factors linked to OA. These include things like serum cholesterol levels, which have a strong association with OA progression, nutritional deficiencies such as low vitamin K, which plays a role in bone and cartilage mineralization, and certain foods to help reduce inflammation and promote joint health. These benefits make the inclusion of a nutrition professional essential in any comprehensive knee OA program. As a result, we believe that a program combining both physiotherapy and nutrition coaching is essential for effectively addressing knee osteoarthritis in meaningfully overweight individuals. Nevertheless, while developing such a program might seem straightforward, there are several challenges that must be addressed to ensure its success. Today we will outline these barriers and present what we believe to be the most effective solution to overcome them. But first, as always, please take note of our disclaimer. One of these significant barriers to a knee OA program combining both physiotherapy and weight management is that there is considerable time and effort required to work with both simultaneously. Attending in-person sessions for even one of these professionals involves preparation, commuting, and often the hassle of finding parking. Now imagine doubling these efforts to see both. It quickly becomes a substantial logistical challenge. Even if both providers are conveniently located in the same clinic, scheduling back-to-back sessions is rarely an option unless the clinic makes a deliberate effort to coordinate, which in most cases is unlikely. And the other challenge is that many of the concerning population feel reluctant to pursue in-person physiotherapy due to fear and discomfort. A common concern is the potential need to remove clothing during evaluations, which can make overweight individuals feel exposed and vulnerable. This discomfort is often tied to the stigma associated with being overweight, such as assumptions of laziness, a lack of self-discipline, selfishness, or impulsivity, or even a combination of these stereotypes. Additionally, many individuals fear embarrassment. This could stem from struggling to perform basic movements or exercises that may be easier for people with lower body weight, or from being perceived as weak due to challenges with strength and conditioning. To make matters even worse, these fears are compounded by the increased likelihood of anxiety symptoms and disorders among those who are significantly overweight. Research suggests that obese individuals have a 30% higher risk of developing an anxiety disorder and a 40% higher risk of experiencing anxiety symptoms such as blushing, sweating, rapid heart rate, or feelings of nausea. These factors collectively create a significant emotional barrier, further discouraging many overweight individuals from seeking in-person physiotherapy. So, what is our solution to these problems? How can we make an osteoarthritis program for overweight people that incorporates both weight management and physiotherapy? which overcomes the logistical barriers of time and effort mentioned, as well as the intimidation for the relevant population. Well, it's to make it all digital. From the logistical barrier standpoint, this will remove all the wasted and inconvenient time and effort that attending in-person sessions necessitates. Also, it will allow the patients to have consultations at convenient free periods during the day, like on their break, that wouldn't be possible to do in person due to time restrictions. And then, from the fear barrier perspective, digital physiotherapy offers a significant advantage by providing an increased sense of comfort and privacy. Conducting sessions in the comfort of their own home, a safe and familiar environment, can help patients feel more confident when trying out exercises. This setting can also minimize feelings of self-consciousness about their weight, which often deter people from attending in-person sessions. And the nature of online physiotherapy, this allows the option for manual, in-person assessments that are typically done in a clinical setting. As a result, patients are less likely to be asked to remove clothing, a common concern for many. This reduced likelihood makes patients more open to participating in physiotherapy, as the process can feel less intrusive and more accommodating to their comfort level. But you may then ask, well, wouldn't without a manual in-person assessment greatly lessen their chance of recovery? Well, we'll never say that digital physiotherapy is on par with in-person sessions for musculoskeletal conditions, even if a 2023 systematic review suggests so. There is a significant value in body language and the ability to be fully present with the patient, something that can't be replicated as effectively in an online session. And needless to say, in-person appointments offer direct access to specialized equipment, enhancing the overall treatment experience. Yet, since the consequences of weight gain and sedentary behavior on joint restrictions and muscular imbalances, etc., are most often predictable, and because physiotherapists are quite creative when it comes to substitutes for equipment and using a person's own body weight, it does allow the digital physiotherapist to still come up with an effective treatment plan. Overall, given these solutions, we believe that digitally is the most practical and effective way to manage knee OA in meaningfully overweight individuals. And this isn't a new idea either. It's even been validated by some research, as a matter of fact. In Australia, a randomly controlled trial showed that a combined telehealth program delivered by dietitians and exercise delivered by physiotherapists in the treatment of knee OA led to greater improvements in pain and function, as well as greater weight loss. But what's your thoughts on this? Is this a better way to manage knee osteoarthritis in the relevant population? We'd love to hear from you in the comments section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So, that has been our video. Thanks for watching, and I'll see you next time.